today's topic on NTEP and NLEP related problem cards. Okay, I told all your CRs to inform all of you to study the NTEP and NLEP program thoroughly. This kind of question now will come in your semester and final. Okay, either you have to write or you have to answer. If you have to write, that is the marks division. So, the patient started on ATD in his native state and taken only 2 weeks, that means 14 days. Then probably he came West Bengal for his work, and when he got sick, probably with some of the symptoms, he came to Bolpur UPHC and got diagnosed with sputum positive AFP category of the patient as per NTEP guideline at any moment, or he has to complete at least intensive phase or at least 1 month. Has he completed 1 month? Less than 1 month. Then what is the category? A new microscopically confirmed case of TB, and as per program guideline it is a new case. 3 number আছে, এক লাইনের জন্য তো উত্তরটা নেই. When you have to write, you have to point out the main reasons for your diagnosis. Okay, you have to point out the main reasons for your diagnosis. First point, you obviously got sputum positive AFB. That stands for microbiologically or microscopically confirmed TB case. Then, as per treatment history, how many days he or she has taken the medicine. From that part, the category according to program definition, whether it's a new case or it's a case lost to follow up or it's a resistance case. Many definitions are there. I thought that you will tell me today, but okay, sit sir. What is the treatment? Okay, HRZD. What is H, what is R, what is Z? Look, 4 number is there. Okay, so to get 4 you have to take the drug name, the dose and the duration. If you cannot remember the dose now, that's okay, but at least tell the duration. It's 2 months and continuation 4 months. Okay, then what advice will you give him? 3 marks is there. এখনো ঘুম কাটেন ঠিক করে. What advice will you give him? 3 marks is there. 3 marks এর জন্য at least 3টে অ্যাডভাইস তো বলতেই হবে, তারপর অ্যাডভাইসের গ্র্যাভিটি থাকলে সেই অনুযায়ী নাম্বার পাবে. যদি 3টে ফালতু অ্যাডভাইস হয় তাহলে হাফ করে পাবে, ইনঅ্যাপ্রোপ্রিয়েট অ্যাডভাইস হলে 0 পাবে. ঠিক আছে, যেমন লিখবে সেই রকম নাম্বার. সুস্থ থাকো, বেঁচে থাকো এসব বললে নাম্বার তো দেবো না, তাই না? সো টিবি রিলেটেড অ্যাডভাইস স্যার, easy. Follow up. First key problem, you have identified that patient did not adhere to the problem, sorry, to the regimen. That is the first problem. So my first advice will be to complete the regimen. Okay, then you all know that TB drugs are hepatotoxic or renal nephrotoxic, hepatotoxic and nephrotoxic too. Okay, some drugs, mainly hepatotoxic. So there will be alteration or rise of the liver enzymes, ALT, AST, and also for isoniazid what we provide extra? Pyridoxine, vitamin B6. So he has to take those medications. Usually TB is a disease of malnourished state. So, high energy dense nutritional supplements. I gave you a PPT na, recent updates in NTEP in West Bengal. হারিয়ে গেছে নিশ্চয়ই, ঠিক আছে, যেটা হারানো আছে হারানোই থাক, whatever. There you have one, what is the sample EDNS sachet content, it was given. Okay, you do not have to write that ingredients, but you have to write that he should take this EDNS. Then again, did a TB patient get some monetary aid? No sir, not 500 now, 1000 from the last year. Not accepted this kind of answer. 1000 rupees. 1000 rupees monetary aid he should get. Again, if we diagnose a person with AFB or TB, what other disease should we screen him for? HIV and diabetes. Very good answer. This, I don't know how many points are there, 5 or 6. These all points should be written, or you have to tell the teacher. Okay, কেন নয় উত্তর আগে কোশ্চেনটা পড়ো, বুঝতে পারি দেখতে পাচ্ছ কিনা। Now have taken ATD for 2 months, that means completed the intensive phase. Now but then pause, did not take the continuation. So what is the category? At this category বলো, ওদিকে কিছু হবে না তাকে, হ্যাঁ সেটা কি ধরনের ক্যাটাগরি? এনটিপি তে তো আমি যোগ করিনি, মানে যারা অফিসিয়াল তারা যোগ করেন। ট্রিটমেন্ট লস টু ফলো আপ, ভেরি গুড। দেন রেজিমেন্টটা কি চেঞ্জ হবে? whether he is resistance 1, is he a resistant case or not resistant? No sir, resistance check korte hole we have to test, but as per program he did not completed the continuation phase, so we will start him on HRZD for 2 months again. Meanwhile we will test for resistance. What resistance should we check him for? Rifampicin and Isoniazid. Rifampicin resistance checks by which check kora hoy kon test diye? CBNAT. Very good. And Isoniazid? Isoniazid কি কিভাবে রেজিস্ট্যান্স দেখাতে পারে? One is CAT-G gene, another is হচ্ছে তো আরএনএ হয়ে গেল, লিখে দিলি শেষে, ওগুলো হয় বি স্পেসিফিক। সো আর কি চেক করব? যাই হোক পড়ে নেবে CAT-G gene কিভাবে চেক করতে হয় রেজিস্ট্যান্স, or the other ways. And if we get into resistance case, then what is the solution? MDR-TB regimen ki? Suppose it's a rifampicin resistance case. Rifampicin resistance case hole what will be the regimen? What regimen? Long regimen 9 and 16 or short regimen? What is BPAL-M regimen? M ta? Moxiflox. Good. This will be the answer of the second part. 6 number is there. Okay. at least you have to write that we will check for resistance gene for these drugs. If you correctly write the MDR-TB regimen also, then you will get 6 by 6. Time will be there. It's a 10-mark question, at least 20 minutes will be there. And you should take only 30 seconds to recognize the case. Okay, here I am talking on TB. In exam, we will replace the TB with some symptoms. You have to think whether I am talking on TB or not. Okay. You have already done problem cards on NCH, then there will be other problem cards on vaccination and everything. These topics should be top of your mind right now. Exam is coming. Whether it's a MDR-TB symptom I am talking about or a presumptive TB case, whether the patient should be checked for whether I am talking about HIV, this kind of question may come. Okay, what are some symptoms of presumptive TB case? Night sweat, fever, আর pneumocystis তো আছে প্রথমেই সুন্দর হলো আর ফিভার কি ফিভার লো গ্রেড ফিভার আর কি আছে 10টা আছে sudden weight loss যখন বললে sudden weight loss can be seen in warning sign of cancer also তাই না আচ্ছা how many presumptive TB symptoms should be there to suspect a TB case? 4. When we take only one symptom as a to diagnose a person with TB, if the person is PL-HIV, okay, then only one symptom is enough to check for active TB case. And what I am talking about presumptive TB, that is presumptive pulmonary TB symptoms. What is the presumptive extrapulmonary TB symptoms? At least tell one. 3 or 4 is there, huh? Lymphadenopathy, lymph node enlargement. Okay. What is the most common lymph node we see in a TB case? Extrapulmonary? Cervical lymph nodes. Okay. Is he correct or not? What he said? Huh? Okay. So, tomar ki mone hocche? What is his problem? Or no problem? He did not move his right finger. Probably he got injury. Huh? Pale colored patch is just a distraction. That is not his problem. Is he talking right? Leprosy. What are the reasons? 3 marks is there. What is Bablu's illness? You are telling that he has leprosy. What are the reasons? Difficulty in finger movement. Only. Probably he got an injury. Patches. So the person is suffering from leprosy. Multiple patches, pale colored patch. And what are the reasons? For reasons you have to again talk about these 2 points, and if the patient has these patches, will be anesthetic. Okay. What test we perform? To pin prick test. Okay. And then to confirm our diagnosis regarding leprosy, what test we will perform? Slit skin smear, SSS, and it should reveal Mycobacterium leprosy. Okay. Name the drugs and doses required for the treatment according to the national program. এমন উত্তর দিও না যাতে তোমাকে ডাক্তার না বলে যে জেনারেল গুগল ডাক্তার। NLEP কি বলে? First, to give a treatment. We have to categorize the patient. Is it a multi-bacillary or Pauci-Bacillary? Why? How many patches should be there? 1 to 5. And এখানে 1 to 5 লেখা নেই, multiple লেখা আছে. It might be 2 even. So, what is the newest revised guideline say? 1 to 5 lesson plus 1 nerve involvement. Okay, which nerve is involved here? Anatomy to movement of right hand, finger movement কি হতে পারে? Most common nerve is ulnar nerve, but right hand movement যদি করতে problem হয়, most commonly the abduction of the thumb, median nerve. Okay, then now he is multi-bacillary case. What is the doses? Dapsone 100 daily, Clofazimine 50 milligram daily plus Clofazimine only 50 milligram daily or once a month is a bigger dose? 300 milligram once a month plus 50 milligram daily. That is the dose of Clofazimine. And what is the Rifampicin dose? Once a month. তো বললাম don't be a Google doctor. গুগলে 3টে ড্রাগের নাম দিয়ে দেবে। What apprehension may you have after giving drugs? 3 marks. Yes, very good. Lepra reaction. What is lepra reaction? Huh? What is the symptoms? How I will assess that this is a case of lepra reaction? What anaphylaxis? Type 1 hypersensitivity reaction. Lepra reaction? Type 1 or 3 or 2 or 4? There are 4 types of hypersensitivity reaction. Is that only lepra reaction or other things should be there? A leprosy patient, disability already shuru hoye geche. I am not asking about the grading. Grading is not as per your course, okay? That is for higher one. At least lepra reaction, what type of hypersensitivity and what to do? Okay, then what to do? Good. What is the dose? Anybody knows? When to do taper off? Okay, at least if you write the lepra reaction and the treatment, you will get 2. Another still you have to get 1 mark on that question. What are you missing? Should we check him for other diseases? Or if there is the disability of some severe grade, we have to do some disability limitation. We have to do some disability limitation, and we have to give, we are giving Rifampicin. The commonest side effect of Rifampicin is orange coloration of urine. So, we have to counsel him for that. This is not a daily dose rifampicin, it is once a month dose, but still the next day urine will be orange. So, we have to counsel him for that. Okay. Next one. Ramesh, a 30-year-old man, complained to the ANM of the subcenter that he developed two macular hypoanesthetic skin patches on his right leg for over a year. Thorough examination by the ANM revealed 4 more similar patches and 2 thickened nerves in the same leg. What is your probable diagnosis? Justify. Now it is easy, again it is a multi-bacillary leprosy case. Okay. Justify, again you have to write like that. Patches are more than 5, hypoanesthetic and thickening of nerves in the leg and disabilities. Okay. Now outline the management of this case according to national program. You all know multi-bacillary, what is the duration? Doses we discussed, what is the duration? 12 months, and if it is a Pauci-Bacillary,
6 months.
Doses are the same. That is the revised guideline. Okay. Leprosy class is taken by NEE, na? I think probably given a PPT. I have already said, yes. So do you the picture of Sapna, the lotus picture, lotus with rising sun. Yes. So PPT will, I have already said the PPT. Please go through the revised guideline. Teachers will expect the revised guideline and treatment guideline for your exam. Okay. And name the nerve trunks which might have been thickened in this case. Common peroneal, yes. And then what are the 2 branches of it that got thickened? Same leg boleche na. Posterior tibial and popliteal. Inpex was the most easiest thing in anatomy. Gagan, 40-year-old daily wage laborer, come to the Itahar Rural Hospital OPD because he has developed 2 hypo-pigmented skin patches on his left arm for the last 1 year. The patches are well circumscribed with loss of sensation. On examination, his left ulnar nerve was thickened. What disease is Gagan suffering from? Give reasons. Again, Pauci-Bacillary or multi-bacillary? No sir, multi-bacillary. If the nerve, in whatever the number of the patches, if nerve trunk is involved, that's a multi-bacillary case. Simple thing. And mention the drug with dosage schedule and duration of treatment. Again discussed. Should he be allowed to continue his work as a laborer? Justify your answer. Should he or should not? Huh? No. Very good. You are living in pre-independence era. আমরা যদি মিলেনিয়াল হই তুমি তারও উপর. So obviously yes. And what are the steps that have been taken to reduce the stigma in the leprosy? বইয়েই আছে এগুলো, আমি বইয়ের বাইরে একটা লাইনও বলছি. What steps? And what is justification that it's not a contagious disease? Is leprosy a highly contagious disease? No. Then he should work as, and if he is getting problems in the work field, what steps as a MO you have to take? Distribute IC, arrange camps to raise the awareness against leprosy. Okay, that to reduce the stigma. And the Gagan should not be prohibited from entering into his work field. He should not be get sacked. These things you as a MO, you have to make certain you can take help from the administration also in this regard. Okay, these things you have to write. 4 things only, nothing. Justify your reasons. I think this is the last one. A 30-year-old man visited the sub-center with complaints of 2 hypo-pigmented, hypoaesthetic skin patches on his right leg for over a year. Thorough examination revealed 4 more patches and 1 thickened nerve in the same leg. Multi-Bacillary, name of the nerve, common peronia.